Coroner's court was present at Bombay and Kolkata, but abolished in Bombay in 1999 and abolished in Kolkata in 1978. In case of death in lockup, the inquest is held by magistrate. Which carries more weight in a court of law? Dying deposition carries more weight. The age of a 16-year-old female is best determined by the radiograph of lower end of radius and ulna. Legal age for marriage for boys in India is 21. Most common pattern of fingerprint is loop. Postmortem staining can occur in some cases before death in cholera. Cephalic index is used for determination of race. Dying declaration can be received by a medical officer. Most reliable method of identification of a person is fingerprinting. Dying deposition is recorded by magistrate. The power of amnesty for capital punishment is vested with the president. Preauricular sulcus is used for determination of sex. Who can be considered as an expert witness? Medical man, firearm expert, and chemical examiner. To determine the age of a 16-year-old girl, which of the following is to be radiographed? Wrist. Conduct money is paid to expert witness with summons from civil court. Ossification center appearing just before birth is lower end of femur. Superimposition technique is used in skull. Second molar erupts at 12 years. Tattoo is useful in identifying body, dead body, and decomposed body. Perjury is willful utterance of falsehood. Death sentence can be awarded by session court. Medical legal autopsy requires the permission of police and magistrate. Best method for identification of person is by fingerprint. In India, inquest is carried out by police, coroner, and magistrate, not by doctor. Rigor mortis is simulated by cadaveric spasm. Medical legal autopsy required the permission of police. Which of the following is true about oath? Oath is compulsory and binds witness for given evidence. Mummification is seen in intrauterine death lately. Rigor mortis is simulated by cadaveric spasm. To make a positive identification with the help of a partial finger point, the points of similarity should be at least 16. Skull of a male differs from that of a female by all of the following except. So what are the differences? Is capacity is greater than 1500 cc in male, orbits square, and frontal eminence is small. Multiplying factor for estimating stature from humerus in males is 5 to 6. Minimum quantity of blood required to be preserved for chemical analysis is 10 ml. Medical certificate is documentary evidence. Eruption of temporary teeth will be completed by 2 to 2.5 years. Colliquative liquefaction is seen 1 week after death. Union of epiphyses at the age of 17 occurs in head of femur. The inquiry into the circumstances of death is called inquest report. A girl of 10 years will have 16 permanent and 8 temporary teeth. Spinal cord is open from backside. CSF is required to be preserved in alcohol poisoning. The temperature of the body rises up for first 2 hours after death. The probable condition include following except frostbite. So the temperature rises for the first 2 hours in sunstroke, septicemia, tetanus, and strychnine poisoning. Multiplying factor of estimating from femur males is 3.6 to 3.8. The most reliable bone for the purpose of medullary index are the following, that is humerus, tibia, and radius. Sternum is not a reliable bone for medullary index. Lower end of femur can help to determine the age. In case of death in lockup, the inquest is held by magistrate. The age of a 15-year-old female is best determined by the radiograph of upper end of radius and ulna. Faint letter mark can be made visible by infrared photography. Which of the following is best for establishing identity is dactylography. Deep inspiration above the water level may cause no effect on flotation of body. A female pelvis differs from male pelvis by obtuse subpubic angle, broad greater sciatic foramen, and broad lesser sciatic foramen is the differences between male and female pelvis. Pearson formula is used for stature. Closure of coronal suture start at the age of 30 to 35 years. Pure Aryans have which type of skull is dolichocephalic. Cardiac polyp is the term used for post-mortem fibrinous clot in a heart. Lungs are preserved in HCN poisoning. A child at the age of 7 years has how many teeth? 24. The minimum age for the appointment of governor is 35 years. Who can commute a death sentence? Any of these, that is High Court, Supreme Court, or the President. Crural index is calculated as length of tibia. The sentence awarded by a court may be enhanced by the higher court. While dispatching blood and urine chemical analysis, sodium fluoride is added as preservative in the following concentration: 100 mg per 10 ml. Exhumation is usually done in the early morning. The most common death by suicide is hanging. The time limit for ordering of exhumation in India is there is no limit. Best specimen for bone for sex determination is pelvis. Best method to determine age up to 14 years is tentation. The common type of inquest in India is police inquest. After post-mortem examination, body has to be handed over to investing police officer for examination. The order should be passed by Chief Judicial Magistrate. Leading questions are permitted only in cross-examination. If angle of mandible is obtuse, it means that the bone belongs to young female child or elderly person. Identical twins may not have same fingerprint pattern. They may have same DNA finger, same blood group and same HLA system. Dying deposition is more important than dying declaration because it is made to a magistrate and cross examination is permitted. Best method for identification of human is dactylography. 100% sure differentiation of sex is possible by pelvic assessment of subpubic angle, obturator foramen, preauricular sulcus, and greater sciatic notch. Postmortem autopsy is done for whole body. After post-mortem, body is handed over to the authority who has conducted inquest in that particular case. Most reliable method of identification of a person is Galton method. Sodium fluoride is used for preservation of alcohol. Perjury is willful utterance of falsehood. First finger loop bureau was established in Calcutta. Rectified spirit not used as preservative in case of phenol. Exhumation can be done in India at any time. The period of mixed dentition is between the age of 6 to 11 years. 20 permanent teeth and 8 permanent teeth are seen at the age of 11 years. Cross-examination of the prosecution witness is done by defense counsel. First permanent tooth to arise is molar. Temperature of a dead body or a person is best measured by rectum. Rigor mortis in a fetus develop after attaining 7 months of age. Chyloscopy is the study of lip print. Corpus delicti means essence of crime. An order for exhumation can be given by additional district magistrate. Subpoena is a kind of document. Pugilistic attitude is seen in protein coagulation. Two carpal bones are radiographically seen in wrist X-ray of most of the children by the end of 2 years. Atavism is when a child resembles his grandparent. The pubic arch in females is above 100. Most specific and sensitive for identification is dactylography.